Well, it's definitely winter outside right now, but swimsuit season isn't that far away. So let's get personal. When you look at your legs, do you see a lot of dimpling and sagging? Well, most of us do, no matter what size, shape, or weight we have. We have cellulite. Have you tried everything from dieting and exercise to creams and wraps, and it just won't go away? Don't feel surgery is your only hope. Dr. Bill Johnson of Innovations Med Spa is here to tell us all about 2 high-tech solutions. Thanks so much for joining us and talking to us about this very personal subject.
Thanks for having me.
All right, let's break it down. Let's define what is cellulite.
Cellulite is the mattress-like or orange peel appearance that happens mostly on the thighs. It can be on the abdomen and arms. It's from the superficial layer of the fat, though, and the superficial layer is the last layer to be affected by weight loss or by exercise. And so you'll find fit, trim women that have cellulite. About 85 to 98% of women in studies have cellulite.
Well, that's nice to know that we're not alone.
Not alone.
It happens to a lot of people. I know when I was in the best shape of my life, this is something that I still had to deal with, and that always boggled me. It's not something that can be cured just through diet and exercise.
Cannot cure it through diet and exercise.
I think it can help, but it certainly won't make it go away completely.
It can make the underlying fat a little less. It can decrease pronouncements, but it will not get rid of the dimpling.
And what causes it to begin with?
The dimpling, if you'd asked me that a couple of years ago, no one could answer that because it's really normal skin and there weren't any studies to really address it. Everyone was addressing it as a problem with fat, and studies recently have shown it's not about the fat.
Okay.
It's about the connective tissue collagen underneath.
And this is what normal skin looks like.
This is normal skin. It has a smooth appearance. It has this collagen, which are the black bands you see going up and down, are thin, and
then this is skin with cellulite.
This is skin with cellulite, where the collagen has become thicker, tightened down, and it compresses the blood vessels and lymphatics.
Okay, well, this is the million-dollar question. How do you treat cellulite?
The treatments have been tried many times, and any treatment that's going to work really needs to address the thickening of the collagen and the fact that the fat is protruding up into the skin. Acoustic wave therapy is one of the very first treatments available to try and address both of these problems.
Okay, acoustic wave therapy. This sounds really just too good to be true and such an exciting innovation. Let's take a look at pictures. We have a few before and after pictures of exactly this concept in progress. What are we looking at here?
Well, this patient is the same patient from in front and in back, and she is, the above is from before, and the other is from 3 weeks later after she had finished her acoustic wave therapy.
Oh, these are huge differences.
Yeah, very big differences.
Unbelievable. And we have another one here.
Now, this lady is about 3 weeks after completing her treatments. So we try and encourage our patients to wait several weeks before deciding how much it has resulted, because the changes continue to improve for several weeks after they've completed treatment.
Okay, so let's talk about this. These treatments are a series of treatments that you recommend, and it's not always a one-time shot. You've really got to be patient, wait the process out, and you're saying 3 weeks after treatment is when all of a sudden you really see those results.
Start to see the results.
So you have to be a little bit patient.
Yes.
How does this technology work?
The acoustic wave is a pressure wave that's going into the skin. It's passing through the skin and fat and breaking up the connective tissue that's tenting down the skin. And at the same time, it's helping thicken the collagen where we want it in the bottom of our skin.
Who's a good candidate for acoustic wave therapy or thermage? Is anybody?
The patients that are a good candidate have dimpled or wrinkled skin in their thighs or abdomens or even on their arms, and don't have a lot of bad varicose veins or are on blood thinners.
Okay, and like you said, it's a series of treatments. Is there a lot of pain associated with it or recovery?
Acoustic wave therapy was actually first used as a pain treatment. So it's very pain-free, and you can go straight back to work.
So this is something we could do in the middle of our day.
Do it in the middle of your day. Thermage, which we use for mostly the loose skin you see often associated with cellulite, is a little bit more. It will give an intense heat, but again, you can go right back to work after thermage.
This is unbelievable. So this treats the loose skin, it treats cellulite, and it's dramatic, and would you say permanent results?
The results are long lasting.
Okay.
We do recommend that folks with AWT, the acoustic wave, get maintenance treatments at about 6 months.
Okay.
With thermage, you're going to age again.
Right.
So we need to repeat it in a few years.
Oh, Bill, thank you so much for being here talking about this subject. These results are amazing and a real option for some people.
Yes.
Thanks so much. All right, Innovations Med Spa is located at 1601 Lancaster in Grapevine, but they also provide acoustic wave therapy at the Coffee Day Spa in Dallas and at Larry North Fitness Center in Fort Worth. For more information, call 817-410-7970 or just log on to innovationsmedspa.com. You can also email Dr. Johnson at drjohnson@innovationsmedspa.com. And we'll have all this information on our website, of course, wfaa.com/GMT. Gary, Brenda?
Riding the wave.
Yeah, you may be able to